Hello viewers, I am Dr. Suma, consultant, 49 Fertility Center, Vijayawada. The number of infertile couples are really increasing day by day, and with the advent of artificial reproductive techniques and IVF, many couples are able to realize their dream of parenthood. So, does always IVF result in multiple pregnancies? So, there is a common myth that whenever a patient has to undergo an IVF or an IUI, they may end up in having a multiple pregnancy in the form of twins or triplets. Now, how far is this true? So, definitely when we do any form of artificial reproductive technique, the chances of having a twin or a triplet pregnancy or a multiple pregnancy for that matter definitely increases. This is because of various reasons. Whenever we do an IUI, we usually subject the patient to ovarian stimulation, where we give her certain drugs which will stimulate the ovaries to produce follicles. So, because we are giving her some medications, there is always a chance that she may produce more number of follicles than the normal one follicle that happens in a natural cycle. So, whenever there are more follicles, more oocytes are released, and when there are more oocytes released, there is a chance of several oocytes getting fertilized at the same point of time, which can result in a multiple pregnancy. In a similar fashion, when we talk about IVF, the lady is subjected to ovarian stimulation, where we retrieve many eggs, and once the eggs are fertilized and embryos are formed, we do an embryo transfer. So, while we do an embryo transfer, we usually prefer transferring more than one embryo to increase the chances of a pregnancy, because not all embryos are capable of a pregnancy. Only those embryos which are genetically normal and are of a good quality usually have the capacity to implant. So, usually whenever we are putting back embryos, we put more than one embryo. So, when we put two embryos and both of them implant, there is a chance of a twin pregnancy. If we put three embryos and all three implant, there is a chance of a triplet pregnancy. So, recently as per the ART bill, we have been restricted to 2 embryo transfers, and now all of us are doing 2 embryo transfers. But all the research and all the articles have pointed towards single elective embryo transfer, wherein transferring a single embryo, which is a blastocyst, that is a day 5 embryo, gives the best success rate and the least complication of a multiple pregnancy. So, very often actually patients are excited about having a twin pregnancy, because they think that having two kids at the same time reduces their burden, and if they can complete their family at one shot, and so many people just like the thought of having twins. But as a doctor, for me, I think having a multiple pregnancy is definitely going to be a risk factor, because twin pregnancies are related with lot of complications, like having an abortion or a placenta previa, where the placenta is slightly lower down in the uterus, which can lead to bleeding complications, or a preterm labor, or hypertension in pregnancy, and so on and so forth. The chances of admission to the ICU of the newborn is extremely high with multiple pregnancy. So, considering all of this, as a doctor who wants a safe pregnancy and a healthy baby, I think a singleton pregnancy gives more outcome than a multiple pregnancy. So, definitely with any form of artificial reproductive technique, the chances of having a twin or multiple pregnancy increases. But as a matter of choice, if we want to restrict it, definitely we can do it, and I think that is the way forward. So many people come to us for different treatments for infertility, and we have so many solutions to offer to them. But does doing a fertility treatment guarantee you a pregnancy is what I am going to talk about. So, what exactly are we doing when a patient comes to us for a fertility treatment? So, we as a doctor and as a team can help the couple by increasing their chances of pregnancy, by creating an environment where the chances of a fertilization or the chances of an implantation will increase. Say for example, when we do an intrauterine insemination or an IUI, we subject the lady for ovarian stimulation, wherein the follicles are produced, and we give an injection for the follicle to rupture, and once the egg is releasing, at the time of we time it around the time of the rupture of the follicle, and we do an intrauterine insemination of the husband's sperm. So, by doing so, we are introducing the sperms into the uterus of the female. We are introducing more number of moving sperms, available for fertilization, as a result of which the chances of pregnancy slightly increases. But when we do an IUI, we are sending the sperms into the uterus. Now these sperms have to reach the tube, egg and sperm have to meet, that is fertilization has to happen, an embryo has to be created, and this embryo has to get back into the uterus and implant. So all of these are not in our control. So we cannot guarantee a couple a pregnancy with an IUI. It just simply increases the chances of pregnancy in that particular cycle, which is slightly higher than what they would normally achieve if they had an intercourse. So coming to an IVF, so many people think that if they go through an IVF where the doctor is stimulating the lady to produce more eggs, then they give an anesthesia, they retrieve the eggs, they fertilize the eggs artificially in the lab and create embryos. They select the best embryos and transfer it back into the uterus. So in IVF, we are more or less controlling many things which are not controllable in an IUI. But even here, when we transfer the embryos back into the uterus, the embryos have to implant and a life has to begin. Now this is again not in our control, because not all embryos are capable of a pregnancy, and not always the endometrium or the lining of the uterus is suitable for the implantation to happen. So only if we have a good embryo, a genetically normal embryo implanted or put inside the uterus, when the endometrium is favorable, will the implantation happen and will the pregnancy happen. So this again is not completely in our control. Usually on an average, the success rate of IVF depends on the age of the couple and the reason why they are undergoing an IVF. So the best success rate which a center can possibly achieve could be somewhere around 60 to 70%. That is if we get good quality embryos and the endometrium is suitable. But again, if the age is on the higher side, if we don't get good quality embryos, or if there is some problem with the endometrium, the success rate further comes down. So is there any process which can actually guarantee you a pregnancy? So as of now, there is no such process in the world which can tell you that this will 100% give you a pregnancy. But of course, we have many solutions which can help you improve the chances of pregnancy. So you have to come to us with a positive attitude, and that will definitely help you out, and whatever problems you have, we will go through all of that and suggest you the best treatment, and definitely it will be the way forward. Thank you.